committees.
And you can have it all with your membership in the Greater Bakersfield Chamber of Commerce.
This is Strictly Business, presented by the Greater Bakersfield Chamber of Commerce. Sponsored in part by the law offices of Young Wooldridge, San Joaquin Community Hospital.
And good Monday morning. Welcome back to Strictly Business. I'm Katie Allen with PG&E filling in. Well, joining us now is Stella Williams, the cardiovascular patient care coordinator at San Joaquin Community Hospital. Good morning and welcome, Stella.
Good morning. Thank you.
Very nice to have you here this morning.
Thanks. Nice to be here, too, on Heart Month.
It's hard. Well, what a perfect time to have you on. We
Yes.
planned that perfectly then. Well, you're here joining us to discuss early heart attack care education, specifically in the workplace. So thank you so much for being here.
Thanks.
Let's first talk about that. What is early heart attack care education?
Well, early heart attack care are these stuttering symptoms that patients have sometimes 3 to a month before they actually have the big heart attack. So our message is we want people to notice these subtle symptoms and act on them, because then we can prevent heart disease. You know, we can go on forever how we're going to save your life when you have the heart attack and talk about all of our awards, how we do that. But really what matters most is we need to prevent that heart attack from happening.
And there are these early signs, you're
Yes, they
saying,
are.
and a lot of people, unfortunately, because we're so busy and a lot of us don't want to admit maybe something's going on, is that we ignore them. So
That's right.
instead of having, like you said, all of these wonderful statistics about how we can save you and helping people with heart attacks, how about we don't even get there?
That's right.
So what are the symptoms?
Well, they're very mild.
Yeah.
They have maybe a little discomfort. They're not really having pain because when it first starts, there is no pain involved. Yeah. They're nauseated, they feel a little dizzy, or they feel like a little pressure. The number one question to ask your colleagues or your family or your friends is, do you feel this discomfort when you're moving around, and then does it go away when you relax? Because that is a big red flag that when your heart is stressed and you're up and moving, it's not meeting the demands of the body. So you feel those mild symptoms, and that's the time to react.
So when you don't feel those symptoms when you're sitting, that is a sign that something
Yes.
could be going on. Because
Yes.
people say, let me sit down, let me relax. Okay, it's gone away. I'm fine. Nothing's wrong.
And that's when we find them dead in bed.
yeah.
That's the sad reality.
Yeah, absolutely.
The
No.
problem is when you ask that question and they answer yes to that, that's almost like a cardiac stress test to us. So when we get these patients, we do stress their heart to see if there's EKG changes or pressure or pain or some kind of change in them. So when you ask that question, they answer yes, that's almost like a positive cardiac stress test. So our message is simple. What we're doing is reaching out to the community to act on those subtle symptoms.
Mm-hmm.
You know, let's not wait till the artery's totally occluded, because we can prevent that heart attack from happening.
Yeah, prevention, obviously, and education is key in
Yes.
this. So what if you feel like, and a lot of people say, I don't want to waste anyone's time. It's probably nothing. What should you do?
Well, here's the thing. You have to be proactive. You have to really insist, because you got to remember these are minimal symptoms, but the patients are practicing maximal denial.
Mm-hmm.
Denial is a big heart attack problem, because people are in denial and they wait till the last minute to where they're actually what we call circling the drain. They're actually having that heart attack before they seek help. So what we say is be proactive, listen to what you, your family, or your coworkers are experiencing, and then help them make the decision. They're going to be in denial. They don't want to face the fact. I mean, we all have busy schedules. We all have timelines.
We're all under stress.
And we have a tendency to put the number one killer on the back burner. Well, you can't do that. We have to listen to what our bodies are telling us, and we can prevent that from happening.
We have a wonderful event here in Kern County. It's Go Red for Women. Of course, you know
Yes.
all about it. And I remember leaving that event one year, and two of my colleagues saying, I was terrified sitting there because all of those early warning signs I felt like I had.
Yes.
And I can probably guarantee you none of my colleagues did anything from that step, because, we're under stress, we're working a lot, it's very normal to have those, but it can be a very serious sign of a possible heart
is.
attack.
And these type of patients that are experiencing those symptoms, they want to go on with business as usual. And that's what we're doing, is reaching out to the communities and saying, hey, no, wait. Let's go make sure that you're okay. Those schedules will wait. Those commitments will wait. You're more important.
Absolutely. Having you around is much more
Absolutely.
important. And,
Yes.
and when you think about it like that, it makes perfect sense. How many of those individuals that have said, you know what, something's just not right. I'm coming in, nothing's major, but I want to proactively be my advocate for myself when it comes to my health. How many of those individuals do you think have, won't have a heart attack because of just coming in early?
Well, it's hard to say
Yeah,
because
absolutely.
we're going to prevent that.
Yeah.
If they are at risk, we're going to do a risk stratification and all of that. We're going to go ahead and treat them, be proactive in treating them. But what you have to remember, all heart attacks are not created equal. They have 3 different presentations. Like the first one is absolutely knocks you off your feet into the ground. You're going to need CPR and you're going to need an AED in the workplace to save those type of people's lives. The second type is what we call a ST elevation MI. You have acute injury to your heart. That's when you have those typical signs. You have a Mack truck sitting on your chest or elephant, if you will. And those people know. They're not in denial at all. They know they need help right now. But this third presentation is these mild symptoms that we're talking about. And they think they're going to be okay because they're stuttering. They come and they go and they come and they go. These are the people that are in denial. Oh, I'll see my doctor later. Well, no. That's not, we don't need to let that happen. We have to kind of push them, if you will, to get help, because this is the perfect time when they're in those early stages that can make the biggest difference in heart disease.
And really
that's
prevent a heart
why
attack.
it's the #1 killer, because some of those symptoms are so subtle, people tend to not notice them.
Yeah, and we're talking about noticing the signs in the workplace, and your colleagues who you see every single day, you can be their best advocate for them as well. Do you see this more in men and women, the smaller signs, the third type of heart attack where you see these early warning signs? Is that more in men and women, or is it kind of universal?
Well, I think women have more subtle symptoms than men, but I think it's very much the same in both men and women as being in denial and, oh, this really isn't happening to me. Yeah. I mean, we live our lives like we're indestructible and immortal, and not until we are taken to our knees does that reality really set in.
Absolutely. And we're talking about seeing these signs in the workplace. Is there any other, for those watching and listening right now, that you can say to those individuals in the workplace, what are some other things to look for?
Well, basically, you have to listen to what they're telling you. They have a tendency to make excuses. Oh, well, I just don't feel good because I ate something that wasn't agreeing with
I
me.
didn't
Or maybe
sleep
it's
well last
indigestion.
night. Yeah.
Maybe I'm getting the flu. Those are very typical symptoms. We ask everybody to remember the acronym to help people of ACT wisely. Acknowledge the A in ACT, acknowledge that there is a problem. If you don't realize there's a problem, then you're not going to act on it. Be calm, because it does make people very anxious. Be tenacious. Don't buy into their denial. They have to get help now. The W is willing to help them. They're going to be nervous. Oh, I'm not going to call 911. Offer to drive them.
Yeah, that's a good idea.
And take them in. Be influential. Keep it simple. They're going to be anxious. Be empathetic. I know you have a busy schedule. I will help you with that. Let's take care of you first. And you can't believe how comforting that can be. We want to link them to an emergency room, not to see their doctor, because we can get instant results in the emergency room compared to the doctor's office. The doctor's office is going to turn them around to go to the emergency room anyway. And last but not least, a community outreach. When we see these symptoms in our colleagues or our family or ourselves, that we will act on that. That's the really important message we want to get out there today.
That's wonderful. And the acronym is ACT Wisely.
Act
so all of
wisely.
those letters stand for something that you should be doing on a
Yes.
daily basis. And I think that what you just talked about, the community, following up, making sure, asking questions, someone, continually saying they're not feeling well, and offering to take them, offering to help them.
Absolutely.
I think that's something that as a community we should offer to not only our colleagues, but those that we live with here in the community.
Absolutely.
And so talking about the early warning signs, and prevention. What are some things that people can do to prevent a heart attack?
Well, they have to see their physician. They can do their risk stratification. They're able to predict your risk of having a heart attack. So there's medications they can give you. You can do lifestyle modifications, things like that that are really, really important that people have a tendency to deny, especially here in Bakersfield. We have data that shows that people here in Bakersfield take longer than anyone else to come in for
Why do you
help.
think that is?
I don't know. I really don't, because compared to like Los Angeles and things like that, I don't know if it's the type of people that we have here or we're just all so busy that we're just putting them on the back burner, and you can't put the number one killer on the back burner.
No, you really can't.
Yeah.
And that's so important. It's so interesting to see that that our numbers, that we take longer to get
Yes.
to the doctor. That's really interesting and unfortunate, because unfortunately a lot of people are really struggling with that, and it affects so many
Yes.
people in our community. We all know
And we have
someone.
high amount of heart disease here too,
Yeah.
on top of all of that.
Yeah, we do.
So,
And wonderful research and treatment being done at San Joaquin
Yes.
Community Hospital as always.
yeah.
So thank you so much for
You're
being here. And
welcome.
again, the acronym is ACT Wisely. Make sure you look out for your coworkers and community members if they're showing early warning signs for a heart attack,
That's
because
right.
that's one of your best ways to prevent a heart attack.
That's right.
As always, Stella Williams, cardiovascular patient care coordinator at San Joaquin Community Hospital. Thanks for joining us.
Thank
this morning.
you. Glad to be here.
Yeah, thank you so much. And I'm Katie Allen with PG&E filling in for the Strictly Business Monday morning segment. We'll see you right after the short break.
If your doctor